Injuries can happen when you least expect them. Here's more from the new Braunfels ER and Hospital, who is ready to care for patients with compassion and experience. Dr. Scott Knepper, Chief Medical Officer with new Braunfels ER and Hospital. Thank you so much for being with us today. We're covering some great topics to help our audience just be more informed about any sort of medical condition they may have. And specifically today, we're talking about concussions. What is one, and when does someone know they need to seek medical care for it?
Yeah, great question. So a concussion is a clinical diagnosis, usually with the absence of any abnormal findings on neuroimaging. It can be caused by direct or indirect trauma, and it can cause pretty significant symptoms, but also it can mask severe underlying illness or disease process that's going on due to the trauma itself.
That's incredible to think, right? Maybe an accident, a head bump could cause that, and it could be children or adults that can get concussions, correct?
That's right, yeah. The entire spectrum of age can be affected, and head injuries can be very serious. Obviously, we've probably heard of the tragic incidences, but concussion is important to diagnose because you can actually prevent worsening injury by taking the right steps.
Okay, and when is it safe for someone to return to activity after a concussion?
Generally, it's 24 to 48 hours of rest, and then everybody has, different trainers, different medical staff will have variations of concussion protocol, but the gist of it is slow progression or return to activity while monitoring for symptoms, and it's individualized to the individual based on their risk factors, the mechanism of injury, and what symptoms they're experiencing at the time. So it'll be different for everybody, but the gist of it is generally a slow return to activity as we monitor your symptoms, make sure it's safe for you.
Sure, a lot of monitoring it sounds like, but those symptoms you mentioned, the symptoms, exactly what are they? Do they last a while? And how can you guys help people out with a head injury like that?
Yeah, absolutely. So symptoms can vary on the spectrum from milder symptoms to headache, but more severe and kind of red flag symptoms can be nausea, vomiting, seizure activity, any neurosensory deficits like numbness, tingling, of course, weakness, right? Loss of consciousness at the time of injury. Those are all things that would want to warrant a workup, and you should come in to get evaluated for that by a health professional or the new Braunfels ER and Hospital.
And there, you guys will definitely assess the situation to be able to diagnose exactly what that person's case may be, correct?
Exactly. And so based on who the individual is and their risk factors, we'll determine whether neuroimaging is appropriate and then quickly rule out disease with no wait to make sure that if there is a serious underlying process going on, we can rapidly identify it and then treat it.
Sure, this sounds just very important to definitely keep an eye on. Although I keep thinking, like, we may think we just slightly bumped our head, this could be more severe. So it is important to just listen to your body, would you say?
Yeah, absolutely. Know your symptoms. And then, this is Texas, right? Football's king around here. There's a lot of head trauma. There's a lot of injuries going on. Parents need to know when it's important to get evaluated and not. And when you see those types of symptoms, especially those high risk factors I talked about, the loss of consciousness, the vomiting, those are all signs that you need to come in and be evaluated.
Well, thank you so much for all of this information. You are an ER, so people can literally just walk in if they feel they may be under this diagnosis, correct?
That's correct. There's no appointment necessary. Come on in. We're open 24/7, weekends and holidays. We're happy to see anybody.
All right, y'all give them a call, 830-402-2170, or visit their website, nberhospital.com. Thank you so much for being with us, doctor.
Thank you. Thanks for having us.